Community Needs Assessment in Northern New Mexico. Most of the photos you will see in this presentation were taken while working in the field in Northern New Mexico. This one here was taken in Taos. I completed my field experience project with Presbyterian Healthcare Services. Throughout the presentation, I'll refer to them either as Presbyterian or PHS. Presbyterian was founded in Albuquerque, New Mexico in 1908 as a tuberculosis treatment center by Reverend Hugh A. Cooper. Since then, it has grown into a system of 9 hospitals, a multi-specialty group with more than 900 providers, and a statewide health plan serving 1 in 3 New Mexicans. Presbyterian is a not-for-profit healthcare system governed by a volunteer board of trustees, comprised of community leaders with a variety of backgrounds ranging from tribal leaders, theologians, business leaders, educators, medical administrators, among others. Presbyterian has a purpose statement, which is, Presbyterian exists to improve the health of patients, members, and communities we serve. While PHS was founded in Albuquerque, it has made and continues to make great efforts to expand to the rest of New Mexico to offer statewide healthcare coverage and access to healthcare services. As you can see on the slide, one of the things that lots of the employees at Presbyterian want to get is this letter, basically called the Presbyterian Promise. And it's, Dear Presbyterian, thank you for knowing me, respecting me, listening to me, and treating me with compassion. You ease the way to my best health and provide me with the highest quality care at the lowest possible cost. You communicate clearly and accurately, coordinate my care, and involve me in decisions. I appreciate that you do what you say you will do. And this is from patients and members. I am currently an employee of Presbyterian as a support broker in the Clinical Operations Department as part of the Self-Directed Community Benefit Program. I incorporated my field experience project into my job responsibilities as a support broker. The Self-Directed Community Benefit Program is a Medicaid-funded program. Individuals who qualify for it must meet Medicaid criteria and also have a nursing facility level of care, meaning that their disability or health condition qualifies them to be placed in a nursing home facility. The community benefit piece of the program has the goal of keeping these individuals safe and healthy in their own homes, where many of them are more comfortable and tend to thrive. The self-directed piece allows for another layer of autonomy in which these individuals seek and hire their own caregivers and can request additional services or therapies that they and their healthcare team believe will help them manage their condition. Individuals in the Self-Directed Community Benefit Program receive a yearly budget. Support brokers help these members determine how much they want to pay their caregivers, how many caregivers they are going to hire, and what additional therapies, health-related equipment, or supplies they might want to request. Support brokers assist members in developing a care plan based on what the member wants and helps them prioritize the things they want to request in order to fit everything in their budget. Once every 5 years, members are also eligible to receive a home modification, such as the installation of a walk-in shower or ramp in order to ensure safety in their homes. Support brokers meet with members in their homes once every 3 months and conduct a phone check-in every month to ensure the member is spending their budget appropriately. Because of this frequent contact with members, as well as the intimacy of conducting visits in the member's environment, we usually develop close relationships with many of our members. I personally have a caseload of 65 members and cover a large rural area, sometimes traveling over 100 miles one way to meet with members. Traveling in northern New Mexico is never boring, and I've learned that all-wheel drive is basically a necessity. Plus, you never know when you're going to have to stop to let the cows cross the road. All the starred counties on the map are counties where I have members: Taos, Rio Arriba, San Miguel, Santa Fe, and Sandoval. The self-directed team we basically work remotely from home offices, and then we go out and travel to members' homes to conduct quarterly touch points. Currently, the self-directed team covering northern New Mexico is made up of 3 support brokers, including myself, and 6 care coordinators. Support brokers and care coordinators, we work really closely together to ensure that members have what they need and can continue living healthy and safely in their homes. For my field experience project, I decided that I wanted to conduct a community needs assessment in order to better understand the strengths, resource needs, and important issues in northern New Mexico. The information learned from the assessment will be used to help public health decision makers appropriately allocate resources and focus on issues important to communities in this part of the state. I was able to collect 35 responses from all county areas I cover except for San Miguel County. These counties are largely rural and frontier, experiencing, in many cases, severe healthcare provider shortages. In fact, all 4 counties that I did collect responses in are designated healthcare provider shortage areas by the Health Resources and Services Administration. Lack of access to transportation, grocery stores, healthcare services, places to exercise, and high rates of poverty are major issues in these areas of New Mexico. Therefore, in my assessment, I wanted to focus in on these major issues. You can see here on the slide, this is basically who responded to my assessment. You can see the split of age group. Majority of folks were between 40 and 59. We did have more females respond to the assessment. The majority of counties where I collected assessment responses were in Santa Fe and Rio Arriba. And then you can also see that the ethnicity breakdown, 63% Hispanic or Latino, 14% Native American, 23% white. No respondents selected the Black or African American ethnicity category or the Asian or Pacific Islander. And so in order to focus on these issues, according to the New Mexico Department of Health, approximately 1/3 of Rio Arriba residents, 1/4 of Taos residents, 15% of Sandoval residents, and 12% of Santa Fe residents live in poverty, with Santa Fe experiencing huge income gaps between the wealthy and poor. High rates of poverty and limited access to affordable healthy food choices can cause many families to experience food insecurity. The United States Department of Agriculture estimates that 326,000 people, including 118,000 children in New Mexico, are food insecure. This means 1 in 6 individuals and 1 in 4 children live in homes without consistent access to adequate food for everyone to live healthy, active lives. As you can see on the slide, these are some highlighted findings from the assessment. Availability of dependable transportation and availability of healthcare providers were found to be the most important issues among survey respondents. Since many of these individuals are managing complex health conditions and disabilities, it makes sense that having access to healthcare providers would be a very important issue. Additionally, the majority of these respondents live in rural areas where they must drive long distances to their medical appointments, meaning that having dependable transportation would definitely be a necessity. Respondents were least satisfied with the availability of employment opportunities, but most satisfied with the availability of places to walk or exercise in their communities. Again, since most respondents live in rural communities with high rates of poverty, there tends to be limited opportunities for jobs, especially jobs with living wages. Some other highlights from the survey are listed on this slide. We can see that a little over 70% of respondents did not have enough money to pay for essential needs such as food, housing, utilities, and medicines in the past 3 months. And a little over 70% experienced feelings of isolation or loneliness. Another question that was asked in the assessment is, what do community members like about living in their communities? As you can see from the pictures throughout the slideshow, northern New Mexico is not at all lacking in its beauty and access to nature, and community members know this. 9 survey respondents mentioned the beauty all around them and their communities, while 17 responded with loving the peace and quiet and the privacy and seclusion that their communities offer them. 23 participants love the people in their communities. They like that people are friendly and caring, they watch out for each other, but they also respect each other's privacy. Finally, 15 respondents were happy that family lives close by. This is a key issue that I want to highlight because in the self-directed community benefit program, especially in some of these northern communities, many of them can find it difficult to find and hire caregivers that are actually willing to travel out to where they live to take care of them. In northern New Mexico, in the self-directed program, many members will actually hire their own family members to serve as their caregivers, which offers not only already like a built-in trust for that person, but often these family members live either in the home with the member or close by. So what's next? The community assessment results that I collected were developed and put into a large executive summary report. These results will be shared with the self-direction team. I also plan to make a condensed infographic or fact sheet based on the assessment results that will be developed to disseminate to a larger audience. I'm also currently in discussions with my preceptor about how to potentially expand or improve upon this survey to continue to be implemented across all of New Mexico. Thank you. Just a little disclaimer that none of the photos used throughout this presentation were taken by someone who was actively driving. And here is a slide showing a list of my references.